All right, so thank you all so much for joining us once again for our February 6th webinar presentation on Whole Family Approach Transformation Stories. As we like to do with all of our e-events, we would just want to take a minute to ground ourselves in the promise of community action. We do so because regardless of our different positions, the things that we do, our geographic spread across the country, this is the one thing that unifies us in our work. And it states that community action changes people's lives, embodies the spirit of hope, improves communities, and makes America a better place to live. We care about the entire community, and we are dedicated to helping people help themselves and each other. So a little bit about our project, because you're joining us as a part of our Webinar Wednesdays that we host in part through the Learning Communities Resource Center. Basically, the purpose of our project is to help community action agencies around the country identify promising and innovative practice models through a lot of different focus areas that are important to community action. So long story short, what we do in our project is we help community action agencies like yourselves build capacity to fight poverty more effectively. And this is of critical importance because that is what allows us to really live up to this theory of change that kind of guides the work that we do in our network, particularly thinking about, well, all of the goals. That's what we do in community action, and what our primary intention is through the learning community is to help make sure that agencies across the United States are reaching those goals, that they can fill in that middle part through the different services and strategies that they're offering to make sure that they are effective, innovative, and changing lives. So today, obviously, you're joining us to hear a little bit about whole family approaches and some of the great work that the agencies that are participating with us have been able to achieve over the last year. So I just want to take a minute to pause for a second and kind of, again, ground us in that work of whole family approaches. We'll just take a little bit of time to talk about what it means, what those models look like, and kind of the work that we've been doing through our Community Action Economic Mobility Initiative with the agencies that are joining us today and that you're going to be hearing from in a little bit. So again, kind of to summarize, the way that we look at whole family approaches here at the partnership is that making sure that agencies provide services and think about strategies and ways to provide those services in a way that meets the needs of children and parents together. So a lot of times agencies offer services strictly to parents, they offer services to children, but what a whole family approach encourages agencies to do is to think about ways that they can either co-locate those services, interconnect those services, but make sure that they are serving families as whole units. And here we have a framework. This is a graphic that we use a lot because it's great, provided to us from the two-generation playbook from Ascend at Aspen Institute. And it kind of just gives us a really good idea of what a whole family approach might look like. All of the different pieces that come together that are certainly important for both parents and children, but thinking about how we can really revolutionize the way that we are providing services and impacting families by thinking about how all those different pieces work together to serve whole families. So looking at these different approaches and the ways that agencies can do this work has been the primary focus of our Community Action Economic Mobility Initiative that has been generously funded by the Annie E. Casey Foundation. And really what the purpose of this project has been is to provide high-level training and technical assistance to agencies across the country to help them break the cycle of intergenerational poverty through whole family approaches. It's been a really exciting initiative so far. We just finished off year one in January, and we are very excited to be joined and led in this effort by Jeannie Chaffin, who's here on the line today. So she's joining us, and it's been really great working with her. But what we've been able to do as a part of this project is actually finance a community of practice. So over the course of the last year, 10 community action agencies from across the country have been able to really take part in that high-level TNTA that I just mentioned, and they're going to continue on for another few months to join us. They're going to be with us for 18 months in total, but we're really looking at the ways that, again, community action agencies can really change and implement in innovative ways, the ways in which they're serving families in their communities. So we're really excited to have 6 of those agencies join us today. They're just going to tell us just a little bit about the work that they've been able to do, kind of what their primary focus has been, and their major lessons learned across year 1. So without further ado, I'm going to prime my colleagues here, our agency presenters who are on the line. We're going to actually jump into our first presentation. And first up, we have People Incorporated joining us from Virginia. So whenever you're ready, can you hear us okay?
Yeah, this is Kelly. We're ready to go.
All right, Kelly. So we're going to jump right in.
All right. So I'm Kelly Smith, and I'm the Director of Planning and Evaluation with People Incorporated of Virginia, and I guess I would say I'm our team lead for our whole family community of practice team. But just a quick background, so People Incorporated is a community action agency. We've been in operation since 1964 in Virginia, and we cover 13 counties and 3 cities in Virginia, and kind of in the southwest region up through the northern Shenandoah Valley, and then in the northern Piedmont and greater Prince William, which is kind of just outside that D.C. area. So we have a pretty big footprint. So I'll start with kind of why and how we got moving toward working toward a whole family approach. So we have a couple different programs that we already operate that really cover some of those whole family components. So we have Head Start and Early Head Start programming, which contains that early childhood education components as well as goal setting for families and really kind of that family level support. We also have a program that we call CHIP. It's different than the health insurance program. This is a Virginia state program, but it has home visitors and nurses paired that visit families with children under the age of 7 and really do some work with meeting developmental milestones for those children, and again kind of has some of that goal setting for parents and families in there. And then when we're looking on kind of that parent spectrum of the whole family approach, we're a workforce development provider for a large region in Southwest Virginia. So we're the Workforce Innovation and Opportunity Act WIOA provider for that region. So we do trainings and education and kind of career support and job coaching. And then we also are a CDFI, a Certified Community Development Financial Institution. And through that, we're able to offer affordable financial products, so both small business lending, but then also really affordable personal loans that come along with credit counseling and financial literacy. So really some good services and products that are targeted toward adults. And so where we were kind of coming from was that for the past couple of years, since about 2017, we've been working as an organization working a lot toward integrated service delivery. So this included a whole new client management system, so where we can communicate across programs to look at family-level data, some different kind of work internally around organizational culture, and we really thought, we're making progress on that, and moving toward this whole family approach is really the next step in that process. So we can go to the next slide. So this is when we're talking about, and kind of where we are right now, I'll go ahead and say is, we have those different programs that have whole family components, and right now we're working on that kind of design of how do we systematically and strategically really provide those whole family services across the spectrum. So as part of the community of practice, and I think this is one of the great things that being part of this group has really encouraged us to do, is one of our tasks throughout the process was creating a theory of change. So what are we going to do, and how are we going to get families to be served together, and what do we want to see about that? So we really thought through, what kind of services do we provide and partners provide that we can make sure those children are receiving the services they need, and adults. So we really focused on, we want to really provide that intensive coaching for the whole family that's focused on those family-level goals. And then also providing services to adults like workforce training, post-secondary education, support for parenting, and then that early childhood education and development piece. They're kind of components of both that CHIP program and Head Start and Early Head Start. And then we kind of saw once, we have that in order and we're really working, intensively with these families, that's really a big part that we want to focus on, is that we'll start by stabilizing families, so making sure they have safe, affordable housing, they're starting to increase their income. Once families are stabilized, they can start to build assets. So that might be financial assets, whether that's purchasing a home or a business. It might be educational assets, so maybe a degree, transportation, and then also that social capital and community engagement. Once they're stable, they're building those assets, in the long run, we're going to have stronger families. And those kind of key outcomes that we want to see with our families are increased resiliency, improved child-parent interaction, increased self-sufficiency, and then that increased confidence and self-advocacy. So it's really more than just, yes, we want families to have a living wage and a sustainable income, but that, the strength and well-being of that family as a whole is what's really important. All right, we can move on to the next one. So, this theory of change is really what we want to see happen, but it's definitely a journey to get there. And so some of the first, we really, as we started planning, we're thinking through some barriers to getting there. And one of them was flexible funding. So I think us, like many community action agencies, most of our funding as an agency, we have really, aside from CSBG funding, a lot of our funding is really focused on specific programs. Head Start funding is just for Head Start. CHIP funding is just for CHIP. WIOA funding is just for that workforce development activities. So how do we invest in positions like a coach or navigator to guide family members no matter what program or service they access or what kind of combo they need? And so that was kind of something, that we're working through, is the ability to either braid funding from current funders and then also looking at other funding sources. And kind of with that flexible funding as well, another component that we think is really essential to an effective whole family approach is being able to provide supportive services that are, so things like subsidizing childcare and transportation, so that these participants can successfully participate and really give that time and effort to the program so that we can help hopefully take care of some of those other pieces that might be barriers to their full participation. And I do have to say, I think we're doing a good job, working as an organization and advocating at a state level about kind of how things are going and really looking at kind of what that funding might be. And so the next one is community barriers. So this is, as we're talking about, one of the assumptions in our theory of change is that our community is ready and able to support this approach. And that's an assumption, but we're really working through things like lack of childcare and lack of public transportation in some of our areas. And then that third barrier is organizational change, and this is what I'm going to kind of focus on as we go through, is that, as we were working through that integrated service delivery, we faced some resistance. It's organizational change is really hard and takes a lot of time. And when we were at that Whole Family Institute last May up in Arlington, we were paired up with Metro Community Action, and we're talking about, organizational change and that being a difficulty for us and, getting some peer advice. And they really focused on, hey, maybe you want to do some training before you kind of jump into it. So we can go to the next slide and I'll kind of go from there. So we decided, yes, that's a really great place to start. If we want to have an organization that's ready and able to implement a whole family approach, we need everyone to be on the same page. So our first step, and this is kind of, I think, our big accomplishment so far, is that we did training for all staff from the entire agency on both whole family and then kind of a refresher on integrated service delivery. So we broke it into 3 trainings, so we had about 80 staff at each training. And so it was a really great, we really designed that agenda so there'd be a lot of room for interaction and relationship building across all departments. So we had senior leadership at every single meeting. We started off that training with a video of an interview with one of our current clients who's getting really a good array of services and, talking about what difference that made for their family. We did some group work. At the trainings, we purposefully sat people with folks that they didn't work with every day so that they'd have to kind of get to know people and see some different perspectives, and they had to do some group work with those kind of mixed up groups. We had a lot of fun with a game called Whole Family Feud. So we had some teams playing Family Feud with whole family related questions. And then another great part was that we had, through this community of practice, we had a coach. And so our coach, Gail, was able to kind of Skype into the meeting and do a Q&A and give a presentation on really what we mean by whole family and talk about her experience implementing whole family approaches in other areas. And I think one of the favorite pieces of the training was a staff panel. So we had at each training about 3 or 4 staff from those program components that are already starting to implement whole aspects of a whole family approach. So maybe people from our Head Start programs or our workforce staff. And had them really talk about what difference it makes when you're able to serve both the parents and the children at the same time and what they see for that family. And then also it gave a chance for staff who weren't on that panel to ask questions of their peers. And it really created some great conversation. And I think it gave staff, from all levels an opportunity to share their ideas, which I think was one of the greatest successes of this. And then we ended those trainings with action planning of how in their job now they're able to implement small steps that incorporate aspects of a whole family approach. We can go to the next slide. And so we did a little survey afterward, and I think some of the most exciting stuff was that almost everyone said they felt more knowledgeable about whole family approaches after the training. And then just some of the comments were really great. They had an opportunity to network with staff, and it was a really great experience. They felt like they could give feedback to senior management without fear. And I think that was really, those are the steps we're wanting to make toward changing our organizational culture. So it's just a really positive experience. We got a lot of great feedback. So, yeah, and so just another quick kind of highlight as I wrap up is that we're really trying to, in changing that organization culture, just use this whole family language. So in our annual report that we just released a couple weeks ago, we highlight a family that their youngest child's in early Head Start. The mom, Elizabeth, is getting services through employment training program. She's getting budget and credit counseling. She has access to a low-interest car loan so she can get transportation for work. Through some of our housing programs, we were able to help them purchase a home through our home ownership program. So really all those different aspects, highlighting that we're already kind of doing this, and so we're making steps toward it, and that we can do this, and highlighting those efforts. And so, our successes so far, I would say, making that change in organizational culture. We've implemented an employee engagement council, and so this is representatives from all different kind of function areas of the organization that meet and talk about issues facing the agency and bring recommendations to our senior management. We've started a agency-wide newsletter that highlights, goes out every month highlighting different programs and kind of what their successes are. And I think we've had, improved focus that without participating in this community of practice, we wouldn't be sitting down regularly and making these decisions and really working hard and strategically to making these efforts. We've done better at, talking and communicating our success and really owning it when we do make those even small steps toward our goals. And then I think also we've done a really good job at incorporating advocacy. We recognize that a whole family approach is effective, and it's one of the best ways that we can help serve families who are facing poverty. And so we've been really advocating on a state level for kind of state level support for these types of efforts. So that's been a real success as well. And so then kind of our next step is that we really need to finalize the design for our whole family strategy internally. So we're trying to get in the organizational culture supportive for it, but really we need to finalize exactly what that's going to look like for People Incorporated. And we've been meeting regularly and having lots of really good discussions about what this is going to be. So we're making progress, but we're not there yet. So that's kind of our last step as we go forward. All right, and so this is just the list of our team. I'm our presenter today, but our President and CEO, Rob Goldsmith, our Chief Operating Officer, Angie Grosclose, our Director of Child and Family Development, Donna Buckland, our Director of Community Services, Linda Midget, and one of our Head Start Family Advocates, Janice Belcher, are a key team that's kind of meeting regularly and working on the planning for this effort. So that's a quick run-through of kind of where we started and where we've got through, so I think it's time for questions.
All right. Thanks so much, Kelly. You did great. Thank you again. Go ahead.
I was going to say it's a lot to get through really quickly.
Well, you did it, so great job. So thank you for sharing that perspective of what People Inc. has been able to just think about and change within their agency just by, kind of approaching this concept of a whole family approach and how it can, it can really cause you guys, like I said, just to think about the ways that you're offering services and how you can better reach the families that you're serving. So thank you for that. So we'll pause for just a moment to see if there are any questions. Oh, and we just got one in. So do you have a blueprint anywhere that we could see to help us jumpstart our own approach? So I have a perspective on that, but Kelly, if you have any maybe documents or things that you guys used over the last year that was helpful for you all?
I mean, I would say a lot of those I think as a part of the community of practice, you all have done a great job of providing us with some templates and kind of guiding questions and a lot of pieces to really get that conversation moving. And I don't know how many of those are available to kind of the network as a whole, but I think right now we're working through this design plan, and so it's a pretty big document, but it walks you from everything from the first questions of, what are you trying to achieve, down to who's your target audience, how are you going to reach them, so really high level down to the detail, and I think that's a really good tool to see kind of where to start and the work that you need to do to get there. So I would think that would be a great tool for anyone who's wanting to start this.
Well, thank you for that, Kelly. That's actually the resource I was going to talk about, and it's always better to hear about it from somebody that's used it rather than the people that have made it. So thank you for that. But that tool actually is available online through our resource library. It's called exactly that, the Community Action Economic Mobility Initiative Design Plan, and it's a huge document that kind of walks you through 12 different modules of different aspects of creating, developing, planning, and implementing a whole family approach. Again, I have to give a shout out to Jeannie Chapin, who was instrumental in putting that together, and also one of our colleagues from the Aspen Ascend network. So that is available. I'll try to, if I'm able, maybe one of my colleagues, I can tap them to share the link in the chat so that you guys can access that resource. But it's glad to hear that it was helpful. So thank you for that, Kelly.
Yeah, I would just say we met last week, and I bet we had a 2-hour meeting just kind of finalizing what that target audience is. And those questions in that design plan really make you think through things that you wouldn't otherwise, consider. And so it's just been a really good tool.
Excellent. That's great to hear. Well, I think that's about Kelly's time, so thank you so much again, and we're going to jump into our next presenter for today, and we're going to hear from Aroostook County Action Program. So whenever you guys are ready, go ahead and get started.
Okay, great. Thank you. So this is Jamie Chandler, and I'm the Service Delivery Coordinator at Aroostook County Action Program. And I have asked one of the pioneers at our agency who have been working on this project since its onset, Amy Murchison, who is a program supervisor, to co-facilitate with me. So she will help me to talk through the history since I haven't been here since the beginning. So next slide, please. So I wanted to just familiarize everyone with where Aroostook County is. So Aroostook County is what we call the Crown of Maine, and we are the largest county east of the Mississippi. We cover 6,828 square miles, and we have 9 service locations located throughout the county. So you can see on the slide there, geographically, we are the size of Connecticut and Rhode Island combined, and our population is 67,653. So we are a very large and very rural county that we cover. Next slide, please.
This is a picture of our family council, and our family council was formed as we began this whole family transformation here at ACAP. Our staff represent all departments under the ACAP umbrella. We've been working really hard at developing strategies and guidance to our agency's approach to whole family. Representatives from this group have traveled and done site visits at different organizations to further help us in our transformation. Next slide, please.
So the Family Council has really been instrumental in furthering the work that we do here at ACAP and our whole family approach. And the group did develop a theory of change, which is on the screen here. And so you may recognize so in the middle of our theory of change, we have family stability. And then surrounding the family stability are the pillars of our whole family work, which coincide with the COGs that that Hyacinth had put up on the screen from the Ascend Aspen Institute visual of the COGs that are the important components of whole family. So in order for our families to reach stability, we are addressing health and wellness issues. We're ensuring that they have access to health care and are living in and engaging in healthy behaviors. We're building those economic assets. We're ensuring that they have affordable, stable housing, access to transportation, and financial education, and leading to savings. We're also ensuring we have Head Start, early Head Start, and home visiting programs here at our agency, and so we're ensuring that families that are involved in our whole family work have children that are in high-quality early education settings, and that they're meeting those developmental milestones to ensure that they're ready to enter kindergarten. We too, like People's Inc., are the WIOA provider for our area, so we are able to link our families to workforce development, job training, help them with child care and transportation expenses. And then, of course, the really important piece of this work is our social capital, really reducing that isolation and building those positive relationships for the individuals and families that we serve. We certainly couldn't do any of this without our family-centered coaching staff that sort of hug the work that's happening here, as you can see in this visual. Our family-centered coaches work one-on-one with families to ensure that they are meeting the goals that they set in these areas to make sure that they are able to live a stable or obtain stability. And then, of course, we have data and ongoing program evaluation, because as I go on to this presentation, as you heard with this presentation earlier, we are continually analyzing the work that we're doing and looking at continuous program improvement to ensure that we are meeting the needs of the families that we serve. Next slide, please.
So this slide highlights kind of the big milestones that we've had here at ACAP. It started with our CEO learning about whole family approach, discussions within our agency organizational structure and how that may look different. Family Council was formed with representatives across the agency to really get down to the, as we say, the meat and potatoes of the whole family approach within ACAP. And we did some strategic planning around what those 2-gen principles are. We also tried to access some private funding to support this initiative. Our 5th milestone is when we hired our first family coach in August of 2018 as a 15 family pilot project within our Early Head Start program. Then we were able to apply and be accepted into the community of practice, which is when we started developing our theory of change and our logic model. This summer, July of 18, our 8th and very huge milestone is that Empower went live here at ACAP, and so we are transitioning to a a new data collection system, which we are all very excited about. In September of 2018, Jamie became our service delivery coordinator to really keep moving our family coaching, services, and 2-gen work, whole family work here at the agency. And currently, we are working on gathering the customer voice. Staff had the opportunity from ACAP to visit the Brighton Center in Kentucky this fall, and we really brought back wanting to get more customer voice within our work. Next slide, please.
So as you can imagine, we have had some challenges and barriers along the way. So this visual just shows you a little bit of some of the barriers we've experienced. So agency culture. So how, having staff or helping staff to understand how whole family fits within their daily work, and moving from a grants management perspective to a service delivery perspective and breaking down silos has certainly been a challenge as we've gone through our process. Funding restrictions, as Kelly had mentioned earlier, and then of course data systems or data systems that aren't communicating with each other more specifically, and trying to take homegrown data collection systems and web-based or cloud-based data systems and trying to be able to aggregate that data in order to tell a story. Next slide, please. So one of the as we were preparing our slides, it was asked, what was your aha moment? And as you could tell from our timeline, we had a lot of work over the course of a couple of years, but when it really came together was when we saw this demographic, this graphic that was put out by Ascend, and that really helped us to focus the work that we were doing to those families that that we are targeting for our whole family work. Next slide, please. So, can you go back one slide, please? So what does success look like? So success looks like all of these things. So it is making connections to employment for parents that we serve. It's advocacy, teaching both our staff and our families that we work with about advocating for themselves and for their families. It's our staff working together beyond our silos to get services to the families as they need them. It's families that are stronger and more engaged with each other. It's healthy children. It's children meeting their developmental milestones. And it's our team learning from pioneers from across the country that we can't do this alone, and that together we will be able to achieve this. Next slide, please.
So when we were putting this presentation together, all of our staff that are on Family Council were asked to talk about words of inspiration, and this is what we came up with. All of these are our words of inspiration. Next slide, please.
So next steps are that, as Amy indicated, we will be working to better capture the customer voice, and we will be building the capacity of our central data system. Next slide, please.
And certainly the possibilities, from the dreams of our little local superhero, as you can see in the picture on the left, to our pioneers at the right, possibilities are endless, and we are here to support the dreams of everyone to be the reality, and that even though it's not going to be easy, it's definitely worth it. Next slide. Oh.
So if you have any questions about the work that we've done so far, certainly feel free to reach out to me via email or through the phone, and then I, at this time, would take it back to Hyacinth and would welcome any questions that anyone has.
Thank you. You guys did great.
That's really a powerful statement kind of that you shared at the end, and I want to make sure that we don't pass over that, you know, through this work that you can help make superheroes in your community. I think maybe we should put that on our next publication, or we should get a T-shirt maybe for annual convention. But I think that is a really powerful phrase, that by thinking about the ways that you align and provide services, it really does make that kind of empowering impact on the lives of families. So it's definitely a big lift. It's not an easy, you know, journey to kind of embark on for an agency, especially when you think about concerns with data collection and how you have to change that. That's not easy and it's not cheap, but it really does make a difference in the lives of families. So thank you for sharing that. That was great to hear.
Thank you.
So we do actually have one question that came in, and I think it's for you all. Can you talk a little bit more about how the work of the family coach in your Head Start pilot differs from the work of a traditional Head Start family service worker?
So our family coaches that serve our Head Start and early Head Start families are using a family-centered coaching approach, and so it meets the Head Start program performance standards, but it's really above and beyond that. It's walking with a parent, you know, it's not just maybe doing phone calls and follow-up, but it's going with a parent to support them in whatever goals that they're working on. And so I don't want to say it's different, it's more.
Right. So it's a little bit more of a hands-on approach, a little bit more intensive.
Yes.
Okay, great. Thank you so much.
Welcome.
So I want to be mindful of time. Again, I want to thank you for sharing. Jamie, we really appreciate it. Great presentation. And now we're going to move forward to our next presenter. I'm going to tee up our friends from Blueprints. So whenever you guys are ready, you can unmute and get started.
Okay, hello. We are Blueprints. We break barriers and build futures, and we're powered by Community Action. This is Darlene Bigler. I'm the CEO, and I'm joined today with my colleagues, Jeff Fondelier, who's our Vice President of Operations, Jessica Hayjet-Bates, our Director of Building Futures, and Brenda Franzalio, who's our Director of Early Learning. You can go to the next slide, please. Blueprints, like many community action agencies, operated for decades in silos. We're a diverse organization with lots of programs. We rebranded in late 2017, and one goal for our rebranding was to simplify our message so that we could communicate our services more clearly. So you'll see the 4 pillars that we adopted, mind, home, health, and wallet, to describe our services. And we had an aha moment when we realized that the timing was perfect while we were rebranding to really work at de-siloing our organization, which led to the ultimate decision to incorporate a whole family approach throughout the organization. Rebranding and a whole family approach provided us the opportunity to look at wrapping our services around our clients, not our departments or silos. So we initiated our whole family approach in January of last year, 2018. Next slide, please. This is our working theory of change. It's very much a work in progress, but our theory of change is centered on leading families to self-sufficiency by engaging them in early learning, adult education, family strengthening services, and career pathways. Our focus is on families engaged in our Head Start programs. We operate early and Head Start. We wrap our services and those of our partners around our families to help them achieve their outcomes. In addition to quilting services around families, we help them to create whole family plans. And we've engaged the community in a crowdsourced fundraising initiative to overcome individual barriers faced by our families. We've selected key outcomes for children, adults, and family, and we've developed a data collection and analysis system to evaluate our progress. Next slide, please. We refer interchangeably to our approach as 2Gen and whole family. We just, I guess, haven't made up our minds yet. Our focus is on family and community well-being, which we help achieve by coaching our adults to build career pathways and engaging the community in overcoming family barriers, ranging from repairing cars or buying new tires to making home repairs to paying application fees for post-secondary education. Ultimately, we hope to make systemic changes throughout our organization so that we're seamlessly addressing whole families. Next slide, please. This slide refers to the specific services provided to our 2Gen children, adults, and families. And we provide opportunities to our families to build social capital amongst themselves through monthly family meetings and by providing participation incentives so that families can participate in individual family activities. Let's see. I think we need to go back a slide or so. There we go. Yeah. So this talks a bit about what our milestones were in the first year. We currently have 24 families actively engaged, and we've secured funding to hire a 2Gen coordinator. We have established a guiding coalition of employers, service providers, and post-secondary educators. And we're proud of the curriculum that our staff developed that we call Families Growing and Learning Together, which is the basis of our monthly family meetings and covers topics ranging from budgeting to job readiness to career pathways, and was informed in part by our families. So as we talked about earlier, we adopted key outcomes this first year. We developed and implemented a data collection system and are really beginning to do some analysis on that. Next slide, please. So these were the challenges, and it's interesting that so far the three agencies who have presented have had similar challenges. For us, certainly integration throughout the organization of the whole family approach is our primary challenge. Beyond that, finding sustainable funding, we, as I said, did acquire funding for a 2Gen coordinator for the first year, but it is annual funding, so we are challenged with trying to find funding to sustain that position, which is quite important to our approach. And we've also been challenged to kind of keep our eye on the ball, where we're focused on the objective of providing services and transforming the agency and families. Sometimes it's easy to get tied up in the tactical aspects of providing all the services to agencies and not looking internally at changing our organization. Next slide, please. So these are our specific outcomes in the first year. We've had 4 post-secondary education enrollments, a graduation, 6 people have secured employment, and 2 have gained assets. Now we need, as I said, to leverage our client outcomes and successes into organizational change and transformation. Next slide, please. So these are some pictures of our success of the first year. On the top left, we're looking at the graduation ceremony for our 2Gen folks who graduated from Getting Ahead in a Just Getting By world. And then on the right, this is a picture of our all-staff training day where we introduced the 2Gen model to our 350 employees. And this was a musical skit where we were illustrating breaking down pillars and silos. On the bottom, there's a picture of one of our children doing some weaving in our Head Start program and learning great skills. And on the far right is a picture of from our all-staff training day again, this time our staff keeping all the balls, or in this case balloons, up in the air as a team. Next slide, please. We're going to see a short video interview with one of our 2Gen participants.
Hopefully you guys see a YouTube video and not my computer screen. Okay, I'm going to play the video.
Whenever I was in the Getting Ahead class that was run by Hillary Clark. Through that class, I also got involved in other programs too, such as Head Start, Family Literacy. So all of those things combined with the 2Gen have helped me to get into college and start to build on my future. Barriers that I've had in my life to becoming successful contributed by 10 years of drug addiction. I have been clean since July 18, 2018, so I'm a little over 3 years clean, and I've had a criminal record from that, so I've had barriers through getting jobs and being discriminated against. Since I started 2Gen, I've enrolled in college and I'm currently going to CAAs to get my associates in psychology. Then I'm going to move up to bachelor's and master's. And they've helped me start the process by getting my FAFSA, helping me apply for that, and applying for classes. So they're pretty much my safety net to starting school because it was so scary. It was a terrifying process for me. And just being in 2Gen, it was nice to be surrounded by other women who were trying to improve their lives as well. And we could talk to each other, just see what everybody was going through and how each of us could help each other. And I just really like having 2Gen behind me to back me up through my whole career in school and further on.
Well, sorry, that was a little bit jumbled. I'm not sure if you could really hear a lot of the dialogue clearly, but Danielle is a recovering addict, and she has a felony record, and she has made amazing progress. In the video, she mistakenly said that she'd been clean since 2018. It's actually 2015, and she has made amazing progress along with her family through our 2Gen approach. So we're really quite proud of her. Could you go to the next slide, please? So here are our next steps in the coming months. We're going to adopt a family-centered coaching model, and you heard the previous agency talk about that. And we believe that that's going to help us integrate whole family as an organizational strategy. All of our programs and services are going to use that as our case management model. We also plan to increase our work with members of our guiding coalition to build stronger buy-in and engagement. And we'll be looking for ways to transform our 2Gen efforts from a program into an agency-wide approach. Next slide, please. This is a member of our team who can provide lots of additional information about any of the specifics that you just heard about, Mallory McHugh.
All right, thank you very much, Blueprints team, and thank you for that that video. We'll share out the link to that recording, to that video after the webinar so that you all can access it. And when you get a copy of the slides, you can see that we put the link in there for you guys to take a peek at that. But it's always really powerful and empowering to hear, individual stories about how this work really not only changes their lives, but then, gives them the strength and self-confidence to then go on and think about how they can help others. So thank you so much for sharing that. We'll pause for a moment to see if any questions have come in from our colleagues at Blueprint. Let's see. I don't think we have any at the moment. But I think you guys did great, and we appreciate you again for taking the time to join us in the conversation and to share about what you've learned and how whole family approaches are changing the way that you guys work with families in your community. So thank you all so much. Okay, so up next, we're going to have Mississippi County Arkansas Economic Opportunity Commission joining us to present. So whenever you're ready, you guys can go ahead and jump in and get started.
Good afternoon. Can everybody hear me just fine?
We can hear you okay. Go ahead.
Okay. My name is Brandon Carruthers. I'm the Family Navigator for Mississippi County EOC. And Mississippi County EOC, we've been around for over 50 years, being instrumental in the war on poverty here in Mississippi County. We've been helping young children gain access to educational services and preparing for public schools, as well as offering those supportive services to parents and other family members. Some of our services include the Head Start, early Head Start. We offer physical and mental health well-being services, financial and housing support, as well as senior living residents. We offer energy assistance and commodity food. We have a Healthy Start program, as well as a Pregnant Mothers program. We also have a Cancer Coalition, a Fatherhood Initiative, as well as a host of partnerships which we refer out to make sure our families get the services that they need to succeed. Next slide, please. Kind of the beginning of our 2GEN, or whole family approach, was being selected as a rural impact site, 1 of 10 through the White House Rural Council. And as a part of that pilot, we chose 50 families to work more closely with and more intensively with, offer the family-centered coaching, and we created parent empowerment, which I'll discuss here in just a second. And we wanted to see how we could, as an agency, improve the way we offer services to parents, children, and families. Next slide, please. Here's our theory of change. It's pretty much been concrete since the beginning of our whole family journey. We made some minor changes, but as you can see, some of our inputs: early childhood education, health and well-being, social capital, post-secondary education and workforce training, job and soft skills, some financial literacy, and referrals through our community partners is what we use to help move our families from a situation of poverty or a situation of insufficiency to a situation of prosperity. And one thing I always like to say, families that thrive create a better Mississippi County, Arkansas. Next slide, please. Some of our milestones, in addition to hiring myself, Family Navigator, to help work closely with the parents and eliminate some barriers to success and help them identify their needs and set goals and walk with them throughout the achievement of those goals. We've started family-centered coaching with our initial 50 families, and we've been trained and started the implementation of family-centered coaching. We've had some buy-in from key stakeholders and our partners in the community, as well as sit down with our governor, Arkansas governor, and some other legislators. There's been a shift in mindset of, I would say, the management team, the staff, as well as the community and partners, of the importance of whole family work and the development of and implementation of the parent empowerment sessions. What the parent empowerment consists of is bringing the families together, where not just the parents, but bringing the parents and the children together and using the parents to identify what resources are needed and what we can do to better serve those parents, and bringing in stakeholders and community partners to fill in the gaps to make sure we offer those services and help those families achieve self-sufficiency. We've also established a one-stop community service center. It's located kind of in the heart of the area where the people we serve are located. In that one-stop community service center, we have a representative from our LIHEAP and commodity food program. We have the Healthy Start program. We have the Parent Center, where they can come in and get resources for them as well as their child. We have, that's also the registration site for that particular area for our Head Start and Early Head Start program, and we have many other services and resources that rotate and come in and out, and that's kind of like the epicenter of the whole family approach. Next slide, please. Some of our barriers to success, as some of my peers have mentioned, number one, funding, working with the resources that we already have to expand and generating a buy-in from staff, partners, and the community. I think one of our major barriers was implementing a shared tracking system for partners, and how we kind of defeated that barrier is through a lot of communication, a lot of Excel spreadsheets, and that's something that we're still working on. Next slide, please. Aha moment. Aha moment for me is when we allow the actual families to come in and tell their story and to tell their impact. We had a site visit with ACAP, and it consisted of a panel discussion with, I think, 4 or 5 of our whole family participants, and to just allow them to tell the services they receive, the mindset that they were in when they first came into the program versus the mindset and the support that they have after coming into us, it was just amazing. So allowing them to tell their story and our impact on their families was a great moment for us. Next slide, please. One major thing that we've combated is breaking down the agency silos. We work so much more closely together since being a part of the whole family approach. And I was in a meeting where we were working on some billboard advertisements for Healthy Start, and we literally had, even though it was for Healthy Start, we had a representative from almost every corner of the agency to help make this thing come together. We hosted a 5K color cancer walk run, and the same thing. We had people from every corner of the agency come together to make this thing a success. And now we've always been service providers, but we service our clients with intentionality to impact not just a child, not just a parent, but to impact that entire family. Next slide, please. Some of our successes, I think we've had success in the family area. We've had agency successes as well as community successes. Our families are reaching short, medium, and long-term goals. Some of our families, or 2 of our families in particular, have purchased a home. Our families are achieving post-secondary education degrees and are moving into higher jobs or better jobs with higher wages. So that's always great. And our family engagement has increased, and we've expanded the services we provide, as well as we expanded the referrals that we can provide through our partners. Another success is simply the families who have participated in the whole family approach. They will tell you that now they feel like they have, because of parent empowerment, they have a support system, and they're building social capital and being connected with people who can assist them throughout the rest of their journey. I think this was just a little piece of advice, and I touched on this already. This experience has really broken down the silos, and overall communication and collaboration have improved throughout the agency. Next slide, please. Our next steps are to expand parent empowerment and intensive case management, as well as family-centered coaching from the 50 families that we piloted throughout all the parents and all the families within our agency. And it will also be to ensure that all the staff, we had a staff orientation, which included a small segment on whole family, but we want to make sure that all staff from the bottom to the top know the importance of the whole family implementation. And I kind of got a new next step from our peers at ACAP, and it's to model and plan a continuous evaluation and improvement plan. Next slide, please. And it just states, when our agency stands in the gap between deficiency and self-sufficiency, children, families gain access to resources needed to break the restraints of intergenerational poverty. And that's really what we work hard to do. Any questions or comments?
All right, thank you so much, Randon, for sharing. Yeah, just to add a little bit of perspective, I know you mentioned it kind of at the beginning of your presentation, but Mississippi County was actually able to join us as a part of another kind of community of practice that the learning community was able to facilitate in partnership with AAP, the American Academy of Pediatrics, to offer technical assistance to agencies in rural areas, exactly to look at that intersection of kind of what you said on that last slide of, I think it was deficiency and self-sufficiency, and really thinking about how rural place-based agencies can really provide that gap or fill that gap through whole family approaches. So it's been really exciting to have you all continue with us through that process. You know, they keep coming back and learning more, and you even heard at the end that they're still gaining things from their peers to take back to their agency and do, so the work kind of never ends. But it's been really exciting to see the work that they've been able to accomplish being with us through these last two cohorts. So, let's see if we have any questions in for our colleagues from Mississippi County. So this is actually kind of a question for all of our presenters, so maybe Randon, I'll start with you if you have any specific resources, and then maybe if any of our other presenters want to chime in, that would be great. But one of our attendees would like to know if you guys have any recommendations on good resources that you've come across during your time in our cohort for training on family-centered coaching for staff. I will say, I think Jeannie sent out a link in the chat to one of our family-centered coaching resources that we've developed here at the partnership. But yeah, I'll tee it up to our presenters if you guys have any resources that have been really helpful for you and just making sure that the word and the idea gets out amongst your staff about the importance of a family-centered approach in your work. And you might need to unmute presenters if you're talking and we can't hear you.
Attended training in D.C., and it was with the Aspen Institute. I have the handouts and the training manual from that I could share with you guys. But other than that, no, ma'am.
Okay. That's great. So I think your audio was cut off a little bit at the beginning, but I think you were talking about some of the resources that were shared at the Whole Family Approach Institute. Did I hear you right, Randon?
Yes, ma'am.
Oh, okay. Great. So I think a lot of those are available in our resource library, but if not, what we can do is in our follow-up email, we'll make sure that people can get connected with those resources and some of those worksheets that you mentioned. But that was an event, again, to give a little bit of context, that we were able to do back in May for participants across all of our learning community groups. So not just this community of practice, but we have a few other groups that we are working with, looking at things like integrated services and financial empowerment, so things that definitely tie into a whole family approach. But we were able to partner with a lot of great organizations, including Ascendant Aspen Institute, to facilitate this 2-day training for our participants in this group. A lot of great resources were shared, and again, I'll make sure that those get posted in our follow-up email so people can access those. So thanks for that. Anyone else quickly have any additional resources, other presenters? Again, you might be muted, so check, that have to deal with like a family-centered approach or coaching and helping to train your staff. Okay, I'll take your silence as a no, so that's fine. But again, we have a few resources related to that topic area on our resource library on the partnership's website, so definitely take a peek at those. So once again, I want to thank you, thank our colleagues from Mississippi County for sharing and filling us in on all that they've been able to achieve over year one. So now we're going to jump into our next presentation, and we're going to hear from our colleagues at Total Community Action in New Orleans. So whenever you guys are ready, you can go ahead and get started.
Great afternoon. My name is Sydney Monroe, and I serve as the Opportunity Center Manager here at Total Community Action. And in the room with me today are 3 additional members of the core team, as well as some extended members. I have in the room with us today Ms. Thelma Harris-French, who is our Executive Director, Mr. Glennis Scott Sr., who's the Director of Energy and Community Services, and along with myself, we have Ms. Janika Julian, who will be presenting as well today, and she is the Family and Community Service Manager. What I'd like for you to know today is that Total Community Action has been in operation since 1965. Last year alone, we served over 23,154 individuals in the parish of Orleans. It is our mission to reduce poverty in our community through collaboration with other agencies, by providing human services, experiences, opportunities that move persons from poverty to self-sufficiency. I'd also like to add, before I get into the actual presentation, that we are the city's designee as the anti-poverty agency for the parish of Orleans. Next slide, please. Here, what you have here is a visual of our Total Family Services. Total Family for us is a comprehensive family empowerment service delivery system, and it is designed to support individuals and families as they work to achieve or work to the achievement of sustainability and economic security. You have a roadmap here, and what I'd also like for you to know is that we are a birth to 5 Head Start model here, but in our Total Family Service and roadmap, you could enter the Total Family Service delivery model through more than just Head Start. If you take a look at this roadmap that's on the screen before you, you could enter through Head Start, you could enter through Target Neighborhoods, or you could enter through our TCA Opportunity Center. In the Opportunity Center, we work with the vulnerable population. Through that Opportunity Center is where we serve our homeless population, we serve our reentry population, we serve people who are coming through for emergency and crisis situations. So if you look at the road and you're traveling, you can see where you could come in and get some assistance. You get some the assistance and assessments, and then you travel the road on through stabilization. Now, once we get to the road where we're going to cross the toll and we go into the road for Total Family, a commitment is involved there. That's one of the major differences. People are committed to being in Total Family. And then you've got various milestones that are listed. And you go on through the toll plaza, and you see you can exit, and after exit, we do have follow-up and sustainability. What I want you to see in this roadmap, people may exit. They may get off the road to self-sufficiency and have to get back on. It's not this is a work in progress, and for those of us who are doing this work, we realize that. So we call our whole family approach, total family. So that's where you may sometimes hear me refer to it as the whole family approach or total family. This is the diagram for you depicting our total family approach. Next slide, please. Next, you have the total family services, and of course you can see our Florida Deletes here, which is our state flower, and within these family services, this diagram, we talk about the family well-being, or we address family well-being, the economic stability, the family and community connections, and most of all, advocacy. If you look at the different family services here, you have workforce development and employment services. We are an affiliate to the America's Jobs Career Center for our parish. The employment services are wide here at Total Community Action. We have various employment and training programs here. We simulate a work environment model that causes folks to participate for 4 consecutive weeks. And they attend all day without compensation, and we simulate a work environment from 9 a.m. to 3 o'clock p.m. Now, some of you are going to say, what's so different about that job readiness program than other ones? In this particular program, the entire first week is dedicated to attitudes and behaviors. And then we go off into just professional development. Let me go on because I know my time is getting short here and continue with the family services. We have financial futures here. We have education and occupational skills training. We have housing, food pantry services, health, early childhood education, utility assistance, parenting education, civic engagement and community involvement, and poverty reduction. Next slide, please. Here we have our theory of change. Total Community Action, Inc. theory of change is our total family, and is rooted into the belief that providing low-income families with comprehensive family-centered case management and coaching, as well as access to necessary family appropriate services and resources, family will commit and actively engage in goal achievement that will ultimately lead to their economic security. That is our theory of change. Next slide, please. With the implementation of Milestones, there are a few bullets that are listed here in the Milestones. Engage family voices through journey mapping, increase the number of families enrolled in total family, refine tools that support and strengthen data collection, expanded initial COP group. And I see on the slide we have defined key building blocks, and I'm going to say refining the key blocks for our 2-generational approach, such as our logic model and our theory of change. We've achieved organizational acceptance of the agency's theory of change. We've presented this theory of change to our board members, to members of our community, internally to our staff, center managers. We have worked in a co-op internally with family advocates who serve as case managers in our Birth to 5 model. We've aligned and expanded internal and external resources in the support of families and case management retreat to build capacity and introduce our family-centered coaching. If you would go to the next slide for me, please, and I talk a little bit about some of the challenges that we may have had or have occurred, and that's staff turnover for the agency, program silos that we have definitely been working to eliminate, leadership and program buy-in, implementation, data collection, and data analysis.
Next slide, please. Two of our aha moments, we have definitely had a lot of aha moments in this process, were our peer-to-peer exchanges that we have monthly, and some of the workshops that we've attended, we realized that we're not in this alone, that other agencies are experiencing the same challenges in implementation of their whole family approaches. And then our biggest aha moment was we'd already started this process of whole family before getting into the COP, but that our assessment tool needed refining to ensure that we covered all of the need areas for families. Next slide. What we feel like have changed so far is that our agency culture has shifted. As Mrs. Sidney alluded to, we did have a lot of silos already formed, but we are in the process of shifting and breaking down those silos and getting people to realize how much this work is they're already doing in their everyday work or job duties, just getting them to realize that it's just already a part of it. So recognizing that, we can really shift towards actually helping the whole family in everything that we do. We also have an increase in knowledge of outcomes rather than outputs. That's that, that idea of not just serving a number, but actually what the outcome is for that family. And then our organizational alignment. We wanted to make sure that our mission and our vision, our strategic plan, everything that we do tied back to serving the whole family. Next slide, please. This is what success looks like for us. As we build staff capacity and family engagement, it helps to move our families from poverty to economic security. So we thought that this visual was very representative of that. As we see that our families take one step at a time towards their goals and being economically secure, we realize that we also have to bring our staff along and continue to build their capacity and have continuous improvement. Next slide. We thought a lot about what we wanted to say as words for inspiration, and we wanted to keep it simple, and it was just as simple as this. When you're going through this process, you have to celebrate the little successes, because if you sometimes don't do that, then it feels like you're going nowhere very fast. So this has been the thing that has kept us going on our journey to make sure that we're doing everything that we can to move our families to economic security. Next slide, please. Our next steps are we're going to work on enhancing a common set of standards of care for TCA's family case management. So we already have a set of standards, but we're going to make sure that everything that we've learned in this experience, that we're going to modify our standards to include those things. We're also going to expand our external collaborative partnerships to build resources for multi-generational families, such as one of our gaps that we recognize is our youth ages 6 to 13. So we're going to make sure that we put a great focus on that group. And then lastly, we want to make sure that we are doing a biannual client assessment feedback process, because we know that being customer focused is very, very important in this. Next slide, please. What our impact looks like is that low-income families are economically secure and live independently. And our goal here at TCA is always not to just make an impact for our families that we serve, but that families in our community in the New Orleans area have viable pathways for all individuals and families to achieve the stability and self-sufficiency, and ultimately prosperity. Next slide. And these are our core members. Contact information that Ms. Sidney talked to you about earlier in the presentation if you have any further questions. And we'd like to thank you at this time for your time.
Thank you so much, Total Team. You guys did a great job. Thank you for sharing with us that really powerful metaphor that you had at the beginning about this kind of being a journey that you're walking with families along. There's a lot of different kind of places to reassess and re-engage and kind of think about this work along the way. And that's definitely a really helpful way to think about a whole family approach. So thank you all again so much for sharing. We appreciate it. And because we're a little bit tight on time, we're actually going to jump right ahead into our last presentation, our last peer group for today. We're going to hear from Mahube-Otwa Community Action. So whenever you guys are ready, you can go ahead and unmute and get started.
All right, thank you. So yes, we are Mahube-Otwa Community Action in Minnesota. My name is Chandler Esslinger, and I'm the Community Health Coordinator for our Family Health Program, which is our subsidized family planning program. And I'm here with...
I'm Jenny Hagan, and I'm the data analyst for Mahube-Otwa.
Next slide, please. And you can skip this one too. Perfect. So the big picture goal for our whole family work and strategic plan is ultimately moving families towards 200% of poverty. We wanted to share some success stories right away. On the left, you'll see one of our young moms who officially became a CNA and went from earning $10 an hour to $15 an hour with her new employer. She was discouraged after not passing her CNA exam for the first time, but with a little perseverance and coaching from our Mahube-Otwa staff, she was able to accomplish her goal and is well on her way towards achieving self-sufficiency. The other two pictures are pictures of our Head Start parents who completed their educational goals this December by graduating from the Minnesota State Community and Technical College here in Detroit Lake. Next slide, please. So the first thing I'd like to address is on the left-hand side of your screen, you'll see our whole family building blocks. They might look a little different than what is included in the National Community Action Community of Practice because it's a hybrid between those building blocks and also the Minnesota 2Gen Network building blocks. To address equity, some of the things that we've been doing is working with our board of directors every month on some discussion items and getting them engaged in a book group around diversity. We've encouraged all of our staff to take Harvard's implicit bias tests. We have an intercultural development inventory qualified administrator on staff. We've established Friday Film Fests and discussions around aspects of diversity and inclusion. And we've also implemented some agency-wide recognition days, including days like National Coming Out Day, Native American Heritage Month, and Dia de los Muertos. Next slide, please. So the next thing that we've been working on is some policy changes. We've created a committee that's focused on public policy specifically. It's in its infancy, and they are consulted and give feedback on proposed bills in our area. This included things like a TANF increase, state-paid family leave, and they respond to other policies that influence our agency and our work. Our agency has also partnered with the Urban Institute through a partnership with the Minnesota Department of Human Services to address why some of our clients have barriers to employment and why do low-wage workers leave their jobs. What we found was that there was a big disparity between metro versus rural employees, and that really showed the need for staff interviews and an emphasis on family voice in these policy changes. Lastly, we've had some family participation days, including the MHSA spring annual meeting. And most recently, one of our Head Start parents got to go to DC for Days on the Hill and also talk to representatives at the White House. Next slide, please. So as we address family voice, one of the things that we've been doing is journey mapping. We've started journey mapping with the program directors, those on the whole family team, Head Start employees, and also housing families. We've also utilized a shared governance strategy, including a SWOT analysis that was done with Head Start Policy Council and our board. Through these shared learning experiences, they provided a framework for our strategic plan, specifically addressing the cliff effect and reducing stigma around poverty and mental health. To speak to the point about organizational culture, one of our employee surveys stated that we had an increase from 48 to 65% on employees reporting they have ability to change the processes that most affect their work. Next slide, please. So for compliance through systems, not people, we created a new position including the Director of Administration, Data Analyst, and also the Head Start Systems Manager. We've also begun the process of creating a universal intake form so that we can collect information once and use it many times. Next slide, please. To address staff working across programs, we've been able to change some seating arrangements for staff for better coordination between programs, and we've also been developing cross-training for housing and Head Start staff as a part of our whole family approach. Next slide, please. Accounting for incomes. As mentioned before, our board has set a strategic plan focused on moving families to 200% of poverty. And in just the past year, our employees report a 20% increase with their ability to use data for their decision making. Next slide, please. So for early childhood, we've created a new position, a Child Care Collaborative Manager, to preserve and expand availability of high-quality early childhood programs in the region. And we've also worked with the school districts to have teachers do home visits for public early childhood programs, similar to our Head Start model.
All right, next, okay, economic assets. So we created a new position called Stabilization Services Manager to work on creating asset building programs, which has really led to community education on asset building strategies, which really helps to focus on helping our clients to move beyond crisis. Next slide, please. Health and well-being. So our efforts have been taken to reduce staff stress by shifting from a regulatory to a generative approach. And we've really got a great employee assistance program. We also have increased emphasis on ACEs and on reproductive health. Next slide. Social capital. So we have a Navigator pilot program in the small community of Perm, which is not too far from here. And we're attempting to help families gain social capital by being paired with community members. So businesses, churches, and other nonprofits to make those really important social connections. And we've also added reducing the stigma of poverty and mental health to our strategic goal. Next slide. Post-secondary and employment. Our employability initiative works with parents on stackable credential career pathways like nursing, childcare, or even light industrial. We have secured new partnerships with tech colleges and nursing homes, and we have a new employment caseworker staff position. Next slide, please. So on our theory of change, the problem that we're running into is that so much of our emphasis had been on crisis management. And so to innovate change, we look at reducing our caseloads, increasing relationship-based approaches, empowering our frontline staff, removing hurdles, addressing equity, and most importantly, we're trying to set bold goals and track outcomes. Our goal is for Head Start and housing families that are past their immediate crisis but demonstrate commitment to goals, increase investment to set them on paths that they define that lead them to 200% of the federal poverty guidelines. Next slide, please. So our key milestones are identifying the organizational values. Our board has a strategic direction. We have had changes in organizational structure and philosophy. We've moved from the highly regulative towards the generative. Increased emphasis on building intercultural awareness and focus our strengths on our staff and our families. Next slide. Our key challenges, though, are limited amounts of new funding, which means there's really limited staff time to change these systems because everyone here already has full-time work to do. Organizational culture change takes time to ensure continuous forward momentum. Next slide. Our aha moments? Well, working on culture, values, outcomes, and empowerment each create small wins along the journey. Small changes can have a great impact, kind of like opening up our Love and Logic curriculum with Head Start to other programs. Coordination across departments has resulted in small perks too, like group discounts for conference registrations. Next slide. So this is our 11-member whole family team. We meet weekly for 30-minute check-ins, and it was really our intention to include a wide range of experience and perspectives on our team. Next slide. So what are our next steps? Right now we're looking at cross-training our frontline staff and agency-wide communication on what whole family strategies are, successes, and setbacks. Next slide. So this ends our presentation. If you have any questions and would like to reach us, here's our contact information. Thank you for your time.
All right, thank you, Mahube team. I know that we're kind of running over time a little bit, so those of you that are joining us, if you can hang tight for just a couple more minutes, we're going to open up the line for questions for our colleagues from Mahube, and we have one in, so I'll read that out for you guys in a second. But if you have any general questions for our presenters, now that you've heard from all of them, we might have time to take a couple of those questions. So if you haven't already, go ahead and send those in through the chat. And we'll take a few of those before we wrap up today's presentation. So, Mahube colleagues, we have one question for you in the chat. One of our attendees would like to know, is curious about what you guys have done or plan to do with the results from the Harvard implicit bias test that you had your staff members take.
Well, we haven't actually recorded any of anyone's results. We wanted to keep that confidential as more of a personal journey than something that we would document. But it is something that we regularly encourage our employees to do. When we send out those, agency-wide emails about different days of celebration, holidays, or days of recognition, if there's an associated Harvard implicit bias test, we would include that in that email as well. And then it's also been a part of how we've done our work with the intercultural development inventory and starting conversations around cultural awareness, intercultural competency, and things like that.
Great. Thank you so much for sharing. Another quick question that we got in, I know that you touched on it a little bit, but could you kind of explain a little bit more your film festival, how you guys came up with that idea, and maybe any curriculum or things that you used to develop that program that you're doing?
So our film festival, we serve a 5-county area, and some of our programs serve even more counties, and our offices are spread out all across our region. So one of the ways that we decided to kind of tackle some of these issues around cultural awareness is through the IDI's philosophy of being exposed to new ideas. So we came up with a list of different films that we felt like tackled specific issues or groups of people or identities or new ideas that we wanted to share. And then that rotates throughout all of our different agency locations. It's a list that we just kind of came up with in our whole family approach group. So it's a diverse list. And so we have just really been inspired by the conversations that we've had after these film festivals, and it seems like a really kind of easy professional development piece as well for our employees. It doesn't cost a whole lot. So that was kind of the impetus behind some of the film festival work.
Great. That's a really cool idea. Thank you for sharing that. I'm sure that's probably one of the easier ways to kind of broach some of those subjects about, like you said, that cultural competency is watching a movie. Everybody can do that and kind of walk away with things to talk about. So that's a cool idea.
It definitely gets the conversation going.
I'm sure it does. So that's really exciting. I want to thank our colleagues from Mahube for sharing and kind of concluding kind of our presentation series that we did here today of hearing from 6 different agencies spread across the country and how just even being open to this idea of whole family approaches, of 2-generation work, how it can really have just a massive impact and kind of ripple through all of the different things that they're doing at their agency across every level. So we want to thank you guys so much for being willing and taking the time to share with the network today your learning, your progress, even your barriers, your challenges, and what you're planning to do for the future. So we really appreciate that. Thank you guys again. Just kind of to wrap up, we'll be very quick. We appreciate all of you taking the time to join us today and hanging a few minutes over. If you enjoyed today's content and you want to hear more of it, we would really appreciate if you would take just a few seconds to complete a survey. It's about like 5 questions just about what you learned and if you'd like to hear more. We do actually read the surveys, and we do use that and tie it into kind of our conversations here at the national level of kind of conversations that would be good to host through our national webinar series. So please, you'll get this when we send out the slides, when we send the email, but if you could take just a minute to fill it out, that would be really great. So hopefully you guys have had a chance to hear a little bit about what we've been able to accomplish, what I should say our agencies have been able to accomplish through participation in the whole family approach community of practice. They're going forward for another several months into this year as they continue their cohort. Hopefully, maybe we'll be hearing from some of them again, kind of as they look back, as they've completed this cohort, about all of the things that they've been able to achieve and accomplish. We'll continue to post resources from this work. We mentioned the Community Action Economic Mobility Initiative Design Plan. We're also working on some different publications that highlight different building blocks of whole family approaches. So you saw kind of our Mahube team go through those, but just through our time in the learning community and assessing the field and looking what different agencies have done and how that's made a difference in the way that they do their work. We're really excited about this publication series that just highlights some of those different foundational building blocks and talks about, provides examples of how community action agencies have done those things, resources. They're going to be really cool and in-depth. So keep an eye out for those coming in the next few months. But with that, I want to thank, again, all of our teams. I want to thank my colleagues, Jeannie and Liza, for joining us today. And I want to thank all of you for joining us for today's webinar presentation. So with that, we're going to conclude. Thank you all so much, and have a great day.